himself in recovery position. You can see this picture where the person lay down, okay, and one hand is in cheek and the leg or knee stop near to his stomach. This is called recovery position. Okay, so this position, this is the best position when there is no airway objection. Okay, so once you have done your first aid part, so you will be with him, the injured person, and you have to be place him in recovery position. How you can place the injured person? You have to be remove all his spectacles. Okay, so firstly lay down his straight, keep him one arm near to the head line, roll with the other hand, and parallelly you have to be keep his leg to roll. Then you can gently support his head by one hand, and this position will maintain his airway open and monitor his breathing. So this will ensure continuously supply of oxygen. He can inhale it. Okay, either it is conscious or unconscious. After you have done the first aid, you always keep him this position. This video will elaborate you how you people can uh, place a recovery position.
If they're unconscious or unresponsive, but breathing normally, put them on their side in the recovery position. This helps them to continue breathing normally by keeping their airway open and clear. For example, it stops the most common airway obstruction. If they're unconscious or unresponsive, but breathing normally, put them on their side in the recovery position. This helps them to continue breathing normally by keeping their airway open and clear. For example, it stops the most common airway obstruction, their tongue, from falling back and blocking the movement of air. It also means that any vomit or fluid which comes back up can come out rather than causing them to choke, which could happen if they're on their back.
To put your casualty into the recovery position, this is what to do. Kneel beside the casualty and get yourself in a comfortable position. Check the casualty's pockets and remove any bulky items. Remove any sharp rings, and if they're wearing glasses, take them off. Make sure that both the casualty's legs are straight. Place their arm nearest to you out at a right angle to their body, with the elbow bent and the palm facing upwards. Their arm can be placed straight out to the side if it can't be placed at a right angle. Take their other arm and place it across their chest and hold the back of their hand against their cheek nearest you. With your other hand, lift their far leg just above the knee. Pull it up until their foot is flat on the floor. Now you're ready to roll them onto their side. Keeping the casualty's hand pressed against their cheek, carefully pull on their bent knee to roll the casualty toward you onto their side. Now their top arm should be supporting their head and their bent leg should be on the floor to stop them from rolling over. Their top leg should be at a right angle to their body. Remove your hand from under theirs. Check the casualty's head is tilted back. This will keep their airway open and clear.
Once the casualty is in the recovery position, you should call for medical assistance if this hasn't already been done. Remember to recheck the casualty's breathing.
Brother, keep a silent at 1 minute after the. Okay, so
If
there is a one question. If person is uh, no breathing, no movement, unconscious, what you will do?
We have to inform them ambulance.
No, if I will ask you, you are the first aider. Okay, in front of you there is a one injured person, unconscious. So what you will do?
We will give them first aid and we will put him in a recovery position and we can call ambulance.
Okay, thank you. And if I will ask you, person is breathing, okay, and he is unconscious. In this way, how you will provide the first aid?
We can just put him in a recovery position and then we can call
Exactly.
ambulance.
You will already call the ambulance, but in this way, you will put him in recovery position. So everyone aware now recovery position. You can put a person in recovery position, okay, until unless help arrive. So before putting recovery position, you have to be maintain his oxygen supply, and you have to be make sure his uh, heart is properly working, his pulse is properly working, he is breathing normally. Okay, so how you will check the person is healthy and having heart is pumping, heart is supplying the blood to all his body? How you will make sure?
We can check his pulse and we can check his he is breathing properly.
Okay, what is the uh, how you will check the pulse? What are the some potential point where you can check?
We can check on the
I
back
think
side
just
of the ear, neck, and we can check also on the ankle. Just
Yes,
putting two
anyone
fingers.
else? Yeah, gently putting two finger to near his neck
Yeah,
area.
yeah.
And what else other?
And other is in
What
ankle,
else other way?
ankle
Ankle
on
or
near
wrist?
near his palm,
hand,
palm,
Wrist,
yeah, yeah,
wrist
on wrist,
area.
palm area.
wrist area.
Yeah, wrist. Where you people step the watch, the wrist area, you can place a finger right
Yes,
down of the thumb area. Okay. So any hand you can check with the thumb
yeah.
area downside, placing two finger will ensure you pulse is normal. And how you will check breathing is normal?
We can just put a finger in front of his nose, so
So
we
how you
can
will
sense his.
feel?
We can
You
sense
can
his
you can
breathing.
place your ear, yeah, you can place your ear near his mouth area, nose area. You will feel some air out, so it will sense person is breathing. And how will check his heart is pumping?
We can just check it from its pulse.
No, sometime pulse, no pulse, but heart pumping. Sometime
I think
heart.
Then
I
we
think
can
just
put a ear on
put
his
one
chest.
ear on the chest, then just I can feel his heart is pumping or
Yeah,
not.
You just remove his shirt button, and if you see chest is rising up and down, it will sense a person heart is properly function. So in this all scenario, breathing, pulse, and but person is unconscious. So what will be your first aid? You just have to be wait the help arrive, and you will put him in recovery position. If person is no breathing, so first aid will be you will provide two breath, mouth to mouth. In case if person is no breathing, no movement, so you will be ready for the CPR.
CPR.
Okay, you will provide the chest compression either by the AED or either by manual. So in next
Yes.
slide, I will help to recognize how you people can CPR. Okay, there is a casualty. Okay, so you see person is not responding. You check his breathing. Okay, he is not normal. No breathing. Pulse is working, but no breathing, no chest rising up. So be ready for the CPR, cardiopulmonary resuscitation. You will start with your s- chest compression. How you will do the chest compression?
By
Two
putting
inch
one hand.
depth,
Yeah,
yeah.
yeah.
By putting one hand to his chest area, okay.
And then
By place other hand
interlock the fingers in his
interlocking
breast.
and place the force up to 1 or 2 inch depth and apply
Yes.
force with your hand and compress. This is the way artificial you can restart his heart again to survive his vital organs. Okay. So before this one, first of all, I will recall the information, check the danger. If you are safe, scene is not dangerous, so you will check the response. Okay. If you see immediately, you will check his breathing is normal or not. You will wait to check until 10 seconds you have to be check his breathing. Okay. If his breathing normal, so you have to and place him recovery position. Simple. If it is breathing is not normal, so you will provide the 30 chest compression and two breath. 30 chest compression and two breath. You will keep doing until unless the ambulance will come to your side to take your injured person. So this is the way you can survive. You can provide the first aid for the injured person having no pulse, no breathing, and no responsive. Okay, so this is the chain block, and how it is functioning well. CPR, just video, uh, see it. It will be helpful
Our
to
heart is
understand.
an amazing organ. It works hard for us every second of every day, delivering blood and oxygen to every cell in our body. But when sudden cardiac arrest strikes, our heart suddenly and unexpectedly stops beating effectively and flips. Without any intervention, the brain, vital organs, and our heart will begin to die. Beginning CPR is the person's only chance of survival. Brain damage will start to set in within 4 minutes, and after 10 minutes, brain damage becomes irreversible. The power to save a life is truly in your hands. Performing CPR accomplishes two critical things. One, compressions move oxygenated blood to the brain to keep the brain alive. And two, compressions keep blood and oxygen moving to the heart muscle itself so that it has the best chance of resuming a normal electrical rhythm after a shock is delivered. As you begin compressions, you are creating an artificial pump and doing the work of the heart manually. With each good, effective compression, you are building up pressure in the system, which will move blood around the heart and up to the brain. It does take time to get the blood moving with CPR, so it is very important to push hard and push fast to build the pressure up, which keeps blood going to the brain. Pushing down at least 2 inches allows for the heart to be squeezed and blood to move out. Pushing at a rate of 100 to 120 compressions per minute is necessary to keep blood pumping. Let's see what happens when we take our hands off the chest. Blood stops moving to the brain. It is for this reason that if you are taking your hands off the chest to deliver breaths or switching roles, it is critical to minimize time off the chest. Watch what happens when we don't push deep enough. Blood does not reach the brain. The same is true if we do not push fast enough. Watch what happens when we push too fast. The heart does not have time to refill with blood. Therefore, not enough blood gets pumped out. Watch what happens when we don't allow the body to decompress and allow the chest to fully recoil. The heart does not have a chance to refill with blood. Therefore, no blood gets pumped out. So remember, the key purpose of delivering compressions is to keep oxygenated blood moving within the heart and up to the brain to keep the brain alive. We need to push hard and push fast in the center of the chest. If ribs break, that's okay. What's not okay is allowing the brain to die from a lack of oxygen. So remember, you are their only hope. Do the best you can and don't give up until medical help arrives or an AED is present. You can do it.
Yes, gentlemen. Someone was asked about the CPR. This is the way you people have to provide 100 or 120 rates in a 1 minute to do the chest compression to restart his blood pumping through heart to your brain to live the person. So this is happened when someone having a cardiac arrest. This is happened when someone having a breathing issue. This is happened someone is drowning. This is the happened someone injured. Okay. So in some cases, ultimately, a person is unconscious, no breathing, no pulsing. You people can immediately provide the first aid can person a safe life. As you are aware, within 3 to 4 minutes, if blood, oxygenated blood, or oxygen supply cut off from the brain, so a person can immediately die. To revert this situation, it is very necessary to provide the CPR. So I will show you one more video to make it more clear about the CPR demonstration. So first I will start to breathing, how you can overcome the breathing problem, and then I will demonstrate you the CPR. Watch this video, it will help to recall the information again.
To the pumping if you can, and always use an AED as soon as it's available. Now let your partner use the mannequin and we'll go through the practice section again. CPR. When normal breathing has stopped, CPR can give someone their life back. The good thing is that it's simple to learn. In this program, you will watch as CPR skills are demonstrated and then have a chance to practice along with the video. Your instructor is a vital link between the mannequin in front of you and the video training. While you're watching, this CPR professional may give you individualized coaching to help you achieve the best results during practice. Skills are divided into two main sections. The first teaches the basics, pumping and breathing. The second section covers when to do CPR. This will help you understand when it's necessary to help someone and what important steps to take prior to starting CPR. Is it easier for you to practice without them, but it's also fine to give CPR in an emergency without them. The risk of infection is very, very low. Let's get started. If you are not already seated next to a mannequin, sit down and get ready to learn skills that could save a life. Sit comfortably while skills are demonstrated. You'll be prompted to get ready for the practice sections. The key reason for CPR is to circulate oxygen to the brain. Pumping the chest acts in place of a beating heart. It's essential to get the speed and force of the pumping right. Watch as this basic skill is demonstrated. You'll practice it in a minute. To pump, our rescuer kneels next to the mannequin and places the heel of his hand in the center of the chest. He puts the other hand on top and interlocks his fingers, then moves his shoulders directly over his hands with arms straight. The rate of pumping is very fast. It's equivalent to 100 to 120 compressions per minute. Let's listen to that rhythm. A full cycle of pumping is down and up 30 times. It helps to count it out loud. Let's see a cycle.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Now, let's practice pumping along with the video. Kneel next to the mannequin with your knees against the side of the chest. To pump, you'll use the heel of your hand. Place it on the center of the chest.
Yes, gentlemen, it is clear.
Yes, sir, clear.
Anyone having any confusion? So please ask me. I will recall this sequence. So first step is always when there is any danger situation, what you will do in first step, you will ensure the area, the scene is safe. Okay. Why? Because there is a chance you also become a victim. The second thing, you position yourself along with the victim side. Ensure it is in flat surface. You also and the injured person also should be in flat situation. Okay. Then next, what you will do, you will tap his shoulder and shout, "Are you okay?" Check his response. He is conscious or unconscious. Unconscious, provide, and immediately you have to be called nearest hospital or 991 or 997 and ask someone to get AED and be ready for the CPR. Okay. So how you will open the airway? There is a formula. It is called head tilt chin lift. You will lift the chin, you will tilt the head, and you will provide the breath. Okay. How you will check the breath? At least 10 seconds you will check his breath. And how you will provide the breath? You will provide one breath for 1 second and other second you will provide another breath. So at least in 2 seconds you will provide the two breath. Okay. By pinching his nose, providing mouth to mouth or providing artificial mouth barrier, you can provide the two breath. And then you will do for CPR. Put the heel of other hand on top first hand and provide the compression at least 1/2 and 2 inch, and you will provide the 30 compression by counting 1 2 3 up to 30, and this should be done in 1 minute. Yani your rate should be 100 or 120 between. Okay. So again, once you finish the chest compression, again provide two breath. Then again provide chest compression. When it is finished, you will provide again two breath. So this cycle you will complete at least 5 times. If you will tired, ask someone other trained person to provide to help you in CPR. And you will keep continue. You will try maximum to save the person life until unless medical staff or ambulance or help arrive to take care or transport the injured person to the hospital. So this is the way you people can provide the manual CPR. There is another way to provide the automatic CPR by help of tool. It is called AED, automatic defibrillator. Okay. So in this case, you will learn how you will do the CPR by the automated external defibrillator. This is the device, this is the machine. It will help only when you see the person is not respond, person is no breathing, person is no pulse. So this machine will be perfectly to restart his heart, to supply the oxygen, to maintain his vital organs. Okay. So normally these type of prom automatically deliver the shock. Okay, you just have follow the instruction. Each AED have their own setup. You just have to read the manual and follow the instructions. Okay, For example, in this video, you will learn how it will work for.
Place pad exactly as shown.
This video is intended to help you understand how an AED works. The ECG strip you are going to see is from Steve's actual save, a real person who is alive today because of an AED and some good Samaritans who took action. Once you turn on an AED, the machine will begin to speak to you. Follow the voice prompts. Once the pads have been placed, the AED will instruct you to stand clear and to not touch the patient while it does an ECG of the heart. The AED is designed to determine if the heart is in a normal rhythm or if it needs to be shocked. In this case, the heart is in ventricular fibrillation, the most common rhythm when someone goes into sudden cardiac arrest. Notice how the heart is not beating effectively. It has electrical activity, but it is uncoordinated. The heart looks like it is shaking like a bowl of jelly. When in this rhythm, you can see the heart is not effectively pumping any blood out. This rhythm is deadly and has to be stopped. When the AED reads a shockable rhythm, the AED will either instruct you to press the shock button, or some AEDs are automatic and will automatically shock the person. At this point, no one should be touching the patient. The AED will send an electrical current through the heart and back again. The purpose of this shock is to stop the heart completely for a very short period of time from this uncoordinated rhythm and give it time to reset. Notice how the shock stopped all the electrical activity in Steve's heart for a brief period. Seconds after this shock, our own SA node, the pacemaker of our heart, will try to regain control of the heart and tell the rest of the heart when to squeeze. It can take up to 2 minutes for the heart to reorganize itself electrically after a shock, before it will function again and effectively pump blood to the brain. This is why you will be instructed to begin CPR immediately after the shock. Your job is to push hard and fast in the center of the chest in order to manually pump blood to the brain to keep the brain alive. Your compressions will not interfere with the heart trying to reorganize itself electrically, so do not worry about that. After 2 minutes, the AED will instruct you to stop CPR. It will reanalyze the heart and advise whether another shock is needed. Always listen to the machine and follow the voice prompts. In Steve's case, the ECG picked up a healthy rhythm and therefore a second shock was not advised. In Steve's case, only one shock was required to bring him back to life. Steve's heart continues to beat and he is alive and with us today.
Yeah, gentlemen, you understand something? You got the point? You got the purpose of CPR? To live the
Yes, sir.
brain, to provide the oxygenated blood through the heart to your brain to live. Okay? Any question?
This observation, AET observation,
This is the electrical shock provider. Okay? He will be completely stop pumping, stop heart in very short period of time. And there is a pacemaker in our heart. It will control it. And again, after 2 minutes, you will provide the CPR. Okay, so abnormal rhythm in your heart or sometime abnormal rhythm cannot be affected to CPR. So AED help to recognize, analyze the heart situation. Okay, so AED will guide you to do the CPR right now or stop the CPR right now, provide the shock right now. So this is the automatic external defibrillator. This is the type of instructor. It will help you when you do the CPR, when you have to stop the CPR. Okay, it will help to regain, to restart your injured person heart. So in malls, in hospital, you can see these type of machine. Okay, AED. I will show you one more demonstration to
Automated external
understand.
defibrillator, or AED.
16, 17, 18.
An automated external defibrillator, or AED, is used when a person's heart stops beating or is beating ineffectively during cardiac arrest. AEDs can be used on adults, children, and infants.
Okay, where you place this pad, in this pad, the sign, the pictogram will help you to make it on the body of the person. Okay, normally it is one in the shoulder and one into his in chest area, downside the shoulder. So, do you ever experience or do you have ever seen this AED at your facility or anywhere? Have you got any chance to observe this equipment?
No, sir.
Okay. Brother, when you need a break, please ask me to stop it. Huh? We'll take a prayer break, or you want to be keep continue to finish, and then you will do for lunch or prayer. Just told me, huh? I'm flexible, no problem. You need a break now, I will allow you to do the break now. Or if you want to be complete this session, let me know what you want.
Our
Okay, sir.
session complete at what time?
Might it will take more 30 to 40 minutes.
No
Okay.
issue.
Can Haris and also Engineer Kamal, what about
Yeah,
their
you can
opinion?
just.
Yeah, you can continue, sir.
So you
Okay, sir.
take one
Because
time break, huh? No need break, no
yes,
need
yes,
go for salah.
yes, yes, yes. After
No,
Everyone will be available,
uh,
right?
yes, yes.
You are not tired, you are not bored. So I will
No,
keep
sir.
continue.
Okay, sir.
Okay, okay. Thank you.
The quicker one is used, the better, because the chances of survival can decrease by as much as 10% for each minute a shock from an AED is delayed.
Everybody clear.
Shock delivered.
These powerful cardiac resuscitation tools are becoming common anywhere people gather. They can be found in places like airports, malls, schools, and churches. But it's important to remember that if an AED isn't immediately available, you should start CPR right away.
1, 2, 3, 4, 5.
Watch the following demonstration as two rescuers use an AED. Rescuers arrive on the scene and start by assessing the person.
Hey, are you okay?
I'm gonna call 911 and get the AED.
Meanwhile, Rescuer 1 begins CPR.
1, 2, 3.
AED
4,
units
5,
come in many
6.
sizes and shapes. Some have start and shock buttons. Some have no buttons at all. But they will all operate in the same way. When you use one, follow the instructions given by that unit.
15, 16,
Rescuer
17,
2 places the
18,
AED
19,
next to
20,
the person's
21,
shoulder.
22, 23,
Now she turns it
24,
on and
25,
follows the
26,
prompts.
27,
Look
28,
carefully at the
29.
pictures on the white adhesive pads.
The AED pads need to make contact with the skin. So, Rescuer 2 must prepare the chest. If it's damp, she will dry it. If the person has thick chest hair, she'll shave some of it off. If no razor is available and there's an extra set of pads, she'll use them to remove hair from the chest. She'll also move any metal that could come in contact with the pads.
Place pad exactly as shown in the picture. Press firmly to patient's bare skin. When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. No one should touch the patient. Analyzing.
Don't touch the person while the AED is analyzing the heart. You must be certain that no one is touching the person.
Shock advised. Stay clear of patient.
Everybody clear.
Press the flashing orange button now. Shock
Be
delivered.
prepared. When a shock is delivered to a real person, muscles jerk. After the shock, Rescuer 1 immediately restarts CPR. They will do 5 cycles of CPR. A cycle is 30 compressions plus 2 breaths. They will continue to follow the AED prompts. There are some differences when using an AED on an infant or a child under age 8. Smaller pads are used, but if none are available, use adult pads. Never use pediatric pads on an adult. Although AEDs are often located in places where people gather, it's important to know the steps to take if you are the only rescuer when you need to use an AED. Let's take a look at how to use an AED with a single rescuer. First, our rescuer assesses the person.
Hey, are you okay? Help!
When he realizes that they are unresponsive and not breathing normally, he calls 911 first.
Hello, I've found somebody unconscious. 120 North Main Street.
Then if he knows an AED is nearby, he goes to get it. Next, he places the AED next to the person's shoulder, turns it on, and follows the prompts.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
If the chest is damp, he will dry it. Also, if the person has thick chest hair, he'll shave it. If no razor is available and there's an extra set of pads, he'll use them to remove hair from the chest. He'll also move any metal that could come in contact with the pads.
When patient's chest is bare, remove protective cover and take out white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. No one should touch the patient. Analyzing.
He is careful not to touch the person while the AED is analyzing the heart. He must be certain that no one is touching the person.
Shock advised. Stay clear of patient.
Everybody clear.
Some AEDs deliver the shock automatically. Some require a button to be pushed.
Press the flashing orange button now. Shock delivered.
After the shock, he immediately gives CPR for 5 cycles. Each cycle is 30 chest compressions and 2 breaths. Now it's your turn to practice. Each cycle is 30 chest compressions.
Yeah, gentlemen, I hope in video demonstration it is clear what does mean by the head tilt, chin lift, what does mean the AED, what does mean the CPR. If still there is any question, please let me know. I will try to clear your doubts. Yes, gentlemen. Just respond me yes or no so that I
Yes,
will
sir.
go
Okay,
for
clear.
further.
Sir, in hospital
Yeah.
we usually use that manual AEDs, like in Pakistan, in government hospitals. When they're giving them the final shock, these are like
Yeah,
iron type.
iron type, yeah.
Yeah, they can
Yeah,
touch
this is
with each other
basically
and
they provide the shock. Yeah. So
yeah.
they are different type. These are the advanced type, or these are the heavy duty. Okay.
Okay,
The iron type are heavy duty.
okay.
So the purpose is just to stop the heart, the abnormal rhythm. It will stop, and then you can continue for the CPR.
Okay.
It's like a reboot, like we do the refresh, reinstall our software
Yeah.
in the mobile phone. Similarly, the function in our body to restart, refresh it, or reboot it, it is called by the AED.
Okay, sir.
Okay,
Okay. Okay.
so it is clear, right?
Yes, sir.
So why in the video they are asking keep area clear, do not touch the body. What is the purpose? Why not touch the body during the
Because
AED using? Uh,
they are shocking the body. They are giving them some
yeah,
current.
they are providing the electric shock. Yeah, if someone will touch the body that time during the deliver of shock, might chances will got the electric shock. To avoid this situation, so AED will instruct you to keep area clear. Do not touch the body. This is the purpose. To okay. So
Yes, sir.
you are clear now AED function. You are clear now CPR. No question,
Yes.
right?
Yes, sir.
Yes.
Yes, sir.
Yes, sir.
Okay. That's good. So shock we have done it. Breathing is also done it.
Sudden
Respiratory.
illness, asthma. Asthma is a chronic respiratory disease that is on the rise all over the globe, affecting some 100 million people worldwide. If not properly treated, asthma can be fatal, so it's an essential part of first aid to understand asthma signs and symptoms. Here's an example of what an asthma attack can look like.
You alright, man?
Asthma.
You good?
My inhaler.
You got your inhaler?
Over there.
Hey, Sean, I got your inhaler, man.
Typical asthma attack signs and symptoms include wheezing, difficulty breathing and speaking, a dry, persistent cough, gray-blue skin, fear, and anxiety. In severe cases, you may see changes in the person's level of responsiveness.
Feeling good? A little better?
Yeah.
Yeah?
Feeling a little better.
If the victim has prescribed medication, such as an inhaler, help the victim use it as directed or as indicated on the prescription label. If difficulty with breathing continues, however, call 911 without delay. And if the person doesn't know they have asthma because it's their first attack, or if they don't have their medication with them, call 911 or your local emergency number.
Okay.
Bleeding and wound care. There are first aid situations where you'll need to control bleeding and care for a wound before help arrives. First, let's look at how to control bleeding. We're going to take you step by step through the technique of controlling bleeding with direct pressure. 1. Put on medical exam gloves or improvise protection from contact with the person's blood if no gloves are available. 2. Place a sterile dressing or clean cloth over the wound. 3. Apply firm pressure directly on the gauze-covered wound for about 5 minutes. 4. Reevaluate the bleeding. If the dressing becomes soaked with blood, don't remove it. Add more gauze and keep applying pressure. 5. If needed, wrap a bandage around the wound to maintain direct pressure to control bleeding. Wrap towards the body. You will know that pressure is sufficient if the bandage is snug, but a finger can be slipped under it. Hemostatic dressings are special dressings treated with an agent that helps control bleeding. They can be used to control severe bleeding or bleeding in areas where a tourniquet can't be used. If direct pressure does not control the bleeding and you have a hemostatic dressing, apply it directly on the wound using direct pressure. 6. If appropriate, treat the person for shock and call 911. A tourniquet can be used when you are unable to control bleeding in a limb using direct pressure or a pressure bandage. Use a commercially made tourniquet if you have one. You can also make a tourniquet using a non-stretch cloth such as a triangular bandage. Let's review the steps to control bleeding with direct pressure one more time. Step 1. Put on medical exam gloves or improvise protection if no gloves are available. Step 2. Place a sterile dressing or clean cloth over the wound, or use a hemostatic dressing if needed and one is available. Step 3. Apply firm pressure directly on the gauze-covered wound for about 5 minutes. Step 4. Reevaluate the bleeding. If the dressing becomes soaked with blood, don't remove it. Add more gauze and keep applying pressure. Step 5. If needed, wrap a bandage around the wound to maintain direct pressure to control bleeding. Wrap towards the body. You will know that pressure is sufficient if the bandage is snug, but a finger can be slipped under it. Step 6. If appropriate, treat the person for shock and call 911. Now, we're going to show you the basics of wound care. To start with, wash your hands and wear gloves if available. Gently wash shallow wounds and abrasions with lots of warm or room temperature water, with or without soap, to remove dirt. Irrigate a deeper wound under large amounts of running water to remove foreign matter. Do not use alcohol, hydrogen peroxide, or iodine on a wound. Pat the area dry.
Are you allergic to antibiotic ointment?
No, I'm not.
Apply antibiotic ointment only to an abrasion or superficial wound, and only if the person is not allergic to it. Finally, cover the wound with a sterile dressing and bandage. Sometimes proper cleaning and bandaging of the wound is enough, and sometimes you need to seek further care. Have the person get medical attention if...
Yes, gentlemen, I will recall the information you learned from this video. So, if someone is bleeding, what will be the first aid you will provide?
We have to wear gloves and put a bandages on the wound and firmly pressure on
Yeah,
the wound.
how you will stop the bleeding? Just directly apply the pressure by help of gauze. Okay. If someone is having abrasion, so what you will do by gently washing the area and put the bandages. But you know, here in Saudi Arabia, and an ointment antibiotic, it is not allowed. Even you are not allowed to keep in your first aid box a Panadol or any antibiotic. It is forbidden. Okay, without doctor prescription, it is not allowed in Saudi Arabia. Okay, clear? So stop bleeding is just only first aid. You can provide it by direct pressure with the help of bandages. This is the way you can stop the bleeding. Clear? Any question?
No, sir, clear.
Okay. Uh, let's review the video related to burn. First degree, second degree, third degree.
Burns. Burn injuries almost always require first aid, and it is the type of burn that determines what first aid steps to take. Burns are categorized in terms of severity by the depth of the burn. First-degree burns, such as sunburn, damage the skin's outer layer. The skin looks red, dry, and painful, and you'll see signs of swelling. Second-degree burns damage the next layer of skin. In addition to the skin being swollen and red, you'll observe blisters, and the victim will experience significant pain. Third-degree burns are the deepest and most severe. There will be damage, such as charred, white, or leathery skin. The victim may also exhibit signs of shock.
Honey, can you take the pot off the burner?
Ow! First aid treatment for all types of burns begins with removing the heat source. For first and second degree burns, immediately cool the burn with running cool or cold potable water, such as tap water, for at least 10 minutes. It's important not to put ice on a burn, as ice can harm the skin tissue. Next, remove constricting clothing or jewelry touching the burn before the area starts to swell. Call 911 in the case of large second-degree burns.
Yes, my daughter burned her hand. We need someone to come quickly. We're at 355 North Durham.
Thank you. Protect the burn area from friction or pressure with a non-stick dressing. Keep the dressing loose, and of course, do not tape it to the skin. Keep any burn blisters intact to reduce pain and improve healing by preventing infection. Seek medical attention for burns on the face, neck, genitals, hands, or feet, and for burns involving blistering or broken skin, difficulty breathing, a large surface area, or other causes for concern. Third-degree burns require additional first aid. Though several steps are the same, remove the heat source. Cool the burn with cool or cold running tap water for at least 10 minutes. Remove constricting items and call 911. In the case of a large burn, do not cover more than 20% of the body with water and not more than 10% with the child because of the risk of hypothermia and shock. Apply a loose, non-stick dressing to the burn area and do not use cream or ointment. Treat for shock if necessary. Do not give the victim anything to drink and watch the victim's breathing. Two distinct types of burns that you might encounter either in the workplace or at home are chemical burns and electrical burns. They require different first aid procedures. Chemical burns can be identified by seeing chemicals on skin or clothing, when the person complains of a pain or burning sensation, when you see a spilled substance on or around an unresponsive person, or when there's a smell of fumes in the air. When dealing with a dry chemical, put on gloves and use cloth or cardboard to brush the chemical off the skin or clothing. If there is a chemical smell in the air, move away from the fumes and ventilate the area. Remove any clothing or jewelry from the burn area in case of swelling. Flush the skin as quickly as possible with running water until aid is available. If the chemical is in the eye, flush the eye with copious amounts of running water. You can use a specialized solution if one is available. If you're irrigating without an eye wash station, tilt the head so water doesn't run into the other eye. Call 911. The final burn category we're looking at is electrical burns, and here you need to use extra caution. First, it is important to protect yourself by ensuring scene safety. Do not touch the patient until you are certain the scene is safe and there is no electrical hazard. Expect that a victim of electrical shock may also need CPR. If you notice areas of burned skin and a source of electricity near the person, such as bare wires, power cords, or an electrical device, suspect an electrical burn. Electrical burns may produce both an entrance and an exit wound. The appearance of an electrical burn is no indicator of how serious it is. Electrical burns can look minor, but still cause significant internal injuries. Care for the burn by cooling down the area with water. Then remove any clothing or jewelry in contact with the burn and cover it loosely with a sterile dressing. If necessary, treat the person for shock. CPR.
Yeah, gentlemen, to clear about the burning, how you can treat as a first aider, just gently running water at least 10 minutes will reduce the impact of burn. Okay. So meanwhile, you already have a call 997 or 991 or nearest hospital. Any question related to burn? Yes, gentlemen. Are you available?
No, no, no.
Yes,
Sir,
sir,
Okay.
even
no question.
sir, as we seen that if some person got any burn area, we will apply this toothpaste. So it is applicable or dangerous?
No, 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 no. No toothpaste, no iodine, no anointment, no anything. It is forbidden in Saudi Arabia, brother. You are not allowed to use. Only if it is a normal burn, you just have to do the first aid only, running fresh water, normal water under, put it his burn area at least 10 minutes until unless help arrive. Or gently just applied non-adhesive bandage and cover the burn area. Simple. Either it is electrical, either it is chemical, either it is fire burn. Okay.
Okay.
Okay, sir, clear.
It is not allowed any toothpaste or any jugaad or any totka, small totka. It is not allowed here. Okay. If someone is in shock, so how you will treat it?
We have to
Just raise his legs
de-electrify.
at least. Sorry?
We have to de-electrify him first. We have to make sure that
Yeah,
there is no current
to
in his body.
maintain his blood supply, to maintain his body temperature, so you just have to raise his leg at least 12 inches high, place under his leg something, pillow or something soft, to maintain his blood circulation, and just place a blanket on it, okay, to reduce the impact of shock.
Okay, sir.
Okay, we are on injury phases. So if someone having head injury, how you will treat as a first aider?
Concussion and head injuries. Concussion is a brain injury that can result from a blow to the head or from sudden violent movement of the head, such as in whiplash. A concussion is a serious matter. Common signs and symptoms include headache or head pressure, feeling stunned or dazed, nausea, dizziness, visual disturbances, sensitivity to light and noise, confusion, difficulty remembering, and change in level of consciousness.
Ow!
Claire, you okay?
No, I really hurt my head.
Here, sit down. Do you feel nauseated? Are you dizzy?
Dizzy a little.
What about your vision? Can you see okay?
Wow, things are a little bit blurry and these lights are making my head hurt worse.
I think you may have a concussion. I'm trained in first aid. Do you mind if I give you some help?
Please.
Let me call the paramedics for you. Just be safe.
Head injuries. Other head injuries can include a skull fracture and a general head wound. Signs of a skull fracture include a deformed area of the skull, a depressed area in the bone felt by touch, or blood or fluid coming from the victim's ears or nose. If the victim is unresponsive but breathing, and there is no chance of a neck, back, hip, or pelvic injury, move him or her into the recovery position. Monitor breathing and be ready to give CPR if needed. Do not clean the wound, press on it, or remove an impaled object. Cover the wound with a sterile dressing. If there is significant bleeding, apply pressure only around the edges of the wound, not on the wound itself. Do not apply pressure if you feel bone fragments move. Do not move the victim unnecessarily because there may also be a spinal injury. Call 911 and stay with the victim. For a head wound without a skull fracture, replace any skin flaps and cover the wound with a sterile dressing. Use direct pressure to control bleeding and put a roller or triangle bandage around the victim's head to secure the dressing. Seek medical attention if any of the victim's symptoms worsen or if the victim later experiences nausea and vomiting, persistent headache, drowsiness or disorientation, stumbling or lack of coordination, or problems with speech or vision.
Clear how you treat the injury? Yeah.
Shock.
When people talk about going into a state of shock, they usually just mean extreme and unpleasant surprise. Medically, though, shock is a term used to describe a life-threatening emergency. Shock is most often caused by serious injury or sudden illness. And when people are in shock, not enough oxygen-rich blood is reaching their vital organs, so it's a critical situation. Some of the signs of shock are visual. The skin is cool, clammy, or sweating, and it can be pale, bluish, or ashen in color. You may observe rapid or shallow breathing, nausea or vomiting, extreme thirst, or changing levels of responsiveness. The person may display some symptoms by talking about or exhibiting dizziness or lightheadedness, anxiety, confusion, agitation, or restlessness. Any of these signs and symptoms alone or together can indicate shock. What do you do to administer first aid in the case of shock? Step 1. To begin, check the person's responsiveness and breathing and look for serious injuries. Correct any immediate life threats you see, such as severe bleeding. Step 2. Call 911.
I think I have somebody in shock. 220 North Main Street.
Step 3. Position a responsive person on their back. If possible, make them comfortable by having them lay on a coat or blanket. If there's no evidence of trauma, raise the legs so the feet are 6 to 12 inches above the ground. Step 4. Be sure to maintain the person's normal body temperature. Step 5. Do not let the person eat, drink, or smoke. Step 6. Stay with the person and offer reassurance and comfort. Now it's your turn to practice.
Yes, gentlemen, any question? You clear now to treat the shock. You clear now treat the burn. You clear now to first aid about the injury. Is there any question?
No,
Just
sir.
say hello, yes, no, so that I know you are available.
Sir,
Okay.
available.
Yes, sir.
Okay.
No, no,
Everything
we are
is fine.
clear. Everything.
Okay. We just
No,
few.
Sir, I have
Sudden illness, stroke. A stroke is a sudden illness.
Yes, someone is saying.
sir, I have a question related to electric shock. If someone gets shock, electric shock, then it is okay, good way or not good way. If someone gets shock, then someone excavate the earth and then put it the person into the excavation and then put it sand back. So some time the person remain inside the earth, then put it again, pull it again back. So this way is correct or not?
Brother, just for your information, there is two type of shock. One is
Yes.
electric shock and one is the shock only. When someone has unpleasant event and he's shocked, that's it's like is you can see the video. This is the unpleasant event happened with this person and he is in shock. Okay,
Okay.
this is the other way to treat the person in shock. But someone is electric shock, how to get the electric shock. There should be a circuit complete. The earth, the current always go for the least resistance. He ultimately enter one part of your body and will go out. The least resistant here it is in ground. Automatically they need a path to come out from the body, and earth is the best least resistance pathway. So when a current flow from the body he will enter, he leave a significance signages. You will recognize he got the electric shock. So the treatment of electric shock is that you will make sure there is no more danger when you provide the help. Bring him in safe area. Okay, check his breathing, pulse. Might be during the shock, during the electric shock, he he might go for unconscious. You have to be check his pulse, you have to be check his breathing. And you can do as a first aid only if it is he's in unconscious. You can provide the CPR to maintain his vital organs. Okay. So the first aid will
Okay,
be
sir.
automatically will convert to the CPR if it is unconscious. Okay, but if he is conscious, he can move. Okay, and he is got the electric sense, electric shock. So the body area having electric burn, you can provide the first aid according to electric burn. And if he is breathing normally but unconscious, just put him recovery position. So it depend on the scenario, what's the situation you people are facing. Utilize your knowledge, and common skill can save a person life.
Okay, sir. Thank you.
Okay. Sudden illness, stroke. This video will be guide you related to the stroke. Okay. In Urdu, we are called like a stroke facial face drop, arm drop, and difficulty to speech. It's like a foliage. So
Illness
watch this
brought
video.
on by an interruption or reduction of blood supply to the brain. When brain tissue is deprived of oxygen-rich blood, the brain cells begin to die. Stroke is always a medical emergency, and prompt first aid can help minimize damage and save lives. It's crucial to quickly recognize the signs and symptoms of stroke and call for help right away.
Honey, for this weekend, we talked about doing some errands on Saturday morning, and I do need your help. Are you still okay with tagging along?
Sure, that's fine.
Thanks, honey.
Wait, where is it we need to go again? There's a game on Saturday I'd like to watch.
Well, we need to go to the grocery store, and we also said we were going to look at a new dishwasher. Is that okay? Well, what time is the game on Saturday? Honey, I asked what time is the game on Saturday? Honey? 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 Can you hear me? What's wrong?
Use the FAST system to recognize whether the person may be experiencing a stroke. Let's look at how Karen uses the FAST system here.
Can you please smile for me?
F stands for face. Is one side of the victim's face drooping or is it numb? If you ask the person to smile, is their smile uneven?
Not right. It's simply not right.
Can you raise your arms for me?
A stands for arm weakness. Is one of the victim's arms weak or numb? If you ask them to raise both arms, does one drift downward?
Say, my name is Scott for me.
My name is Scott.
S stands for speech difficulty. Is the victim's speech slurred, or are they having difficulty speaking or understanding? If you ask them to repeat a simple sentence, can they do it correctly?
Oh, honey, I think you're having a stroke. I need to call 911.
T stands for time to call 911. If the victim shows any of these symptoms, call 911 immediately and note the time when the symptoms first began.
I think my husband's having a stroke. He can't talk, his speech is slurred, and his face is dropping some. My name is Karen Summers. We live at 233 East Wacker Drive, Chicago. Yes. I asked him to smile and repeat something, and he couldn't. Thank you. Yes, please hurry. And just come in the door. I'll go unlock it. Okay.
Lay the victim on their back with their head and shoulders slightly raised. Loosen any constricting clothing.
There we go. Okay.
Signs and symptoms of stroke include sudden weakness or numbness of the face, arm, or leg, especially on one side of the body, drooling, facial droop, slurred speech, and gait problems. Sometimes people may also develop a severe headache, vomiting, or lose consciousness. Remember the FAST system to quickly assess for stroke.
Just lay still, honey, okay? The paramedics are on their way.
Remember the steps for giving first aid for stroke. Call 911 or your local emergency number. Monitor the person's breathing and be prepared to give CPR. Have the person lie on their back with their head and shoulders slightly raised. Loosen any constrictive clothing for easy breathing. If necessary, turn the person's head to one side to allow drool or vomit to drain. Keep the person warm and quiet until help arrives.
Okay, gentlemen. Clear? Any
Yes, sir.
question? I think almost related uh, type of injuries we have covered it. One thing related to diabetes, just watch it and then we will
Sudden
cover.
illness, diabetic emergency. Diabetes is a growing public health threat that affects 500 million people around the world. The term diabetes encompasses a group of related diseases characterized by blood sugar levels not well regulated by the body. The blood sugar can be unnaturally low or high. With low blood sugar, you will observe dizziness, shakiness, or mood change, pale skin and sweating, and the person may report headache, confusion, hunger, or difficulty paying attention. At the extreme end, the person with low blood sugar may have a seizure. With high blood sugar, you may notice the person is short of breath, has deep, rapid breathing, breath that smells fruity, or nausea and vomiting. The person may experience frequent urination, drowsiness, dry mouth and thirst, and eventual unresponsiveness. Diabetic emergencies are common and require immediate first aid care. Let's take a look at a typical situation.
Oh, Donna, I have got to get a break. I'm exhausted. I've been going since 6 a.m. straight.
I know, Sarah, I'm sorry, but we have to get all these rooms done by this afternoon before that convention group starts checking in. I don't know why they promise things when we have to work like robots in order to make them happen. Maybe that's what they need, robots.
Tell me about it.
Sarah, are you okay?
Yeah, I'm fine.
Sarah, what's going on? You don't look so well.
Stupid, I'm fine. I just got so busy I forgot to eat. I get the shakes sometimes. It's a blood sugar thingy.
Sarah, are you diabetic?
Yeah.
Do you have anything on you? Any sugar? Any glucose tabs?
Yeah, downstairs in the break room in my bag.
Carol, let's sit you down.
I'll be fine. I just need a minute.
I don't have anything on me, but I'm sure I can find something that will help. Sarah, it's really dangerous. You can never run out.
I said I'm fine. Just give me a minute.
Here, try this.
Thank you. See, just in a minute. I'll be fine.
You don't look like you're doing any better. It's been 15 minutes. Try these hard candies as well.
Donna, quit fussing over me. We still have a lot to get done. I'll be fine.
Stop worrying about all that. If you're not feeling better after these hard candies, I'm calling 911. No arguments.
It's difficult to know if a diabetic problem is caused by low or high blood sugar. If the person has low blood sugar, give 5 glucose tablets or half a cup of fruit juice, 5 sugar packets, not a non-sugar sweetener, or several pieces of candy. High blood sugar is a true medical emergency. If you suspect high blood sugar, call 911 immediately and monitor the person. But if you're unsure whether it's high or low blood sugar, It's okay to give the person sugar. If the person has high blood sugar, this won't cause additional harm. Just remember to monitor them and call 911 if their symptoms persist.
Okay, gentlemen, we are near to be close, wrap up the session. So, is there any question? Please ask me. I will try to resolve your concern. Yes, Mr. Masroor, Mr. Sheikh Fiaz, Haris, Abdul Qadir, Jamaluddin. Brother, any questions?
No, sir. Thank you. No question.
So, what is your feedback? You get some learning point, or just it's
Yes, sir. This session was very informative for all of us. That's why I learned many things. Thanks for your time
okay.
and
Thank you so much for your patience, your time also. So I know there is some backdraw face-to-face training and online. In online, you just have to be demonstrated through the video or pictogram. But it is highly recommended if in future if you got a chance to same like of training, so must in face-to-face because it will enhance more demonstrative practical hand-on practice will enhance the skills. A practical can furnish more knowledge into or your professional life experience. So thank you so much, all of you. Just inform to Mr. Ali, I think Raza, Ali
Ali
Asgar,
Asgar.
about the
Alias
session.
Ali Asgar.
So yeah, he will share the attendance sheet with me. So I will forward to the coordinator to make arrangement either card or certificate. What is the available? Okay.
Okay,
So
sir.
meanwhile,
Thank you.
thank you so much. Take care, brother. Okay.
Thank you.
Bye
Okay,
bye.
okay. Thank you.
Okay, sir. Thanks a lot.